I'm happy to be with you this evening, and I would like to thank Athan Gadanidis for inviting me to join you in this meeting. And I would like to congratulate the winners of the Aristotle Awards. Since 2016, Aristotle Awards has become an internationally recognized competition, and I'm very proud to be a member of the committee that is responsible for the evaluation of the olive oils that participate in the competition. And I have the responsibility for the measurement of the phenolic content in my laboratory in the University of Athens. And I have to say that this competition has really a really unique character by combining the high phenolic content and the lack of taste defects. It's really a unique combination of characteristics for an olive oil, and it is very important for an olive oil to get the Aristotle Award. This year was really unpredictable, and all the plans were completely disturbed. Everybody knows that the COVID pandemic has created several problems to the whole society all around the world, and not only to the olive oil sector, but this pandemic highlighted the need to consume healthy foods that can protect us from chronic inflammation and keep a healthy immune system. And this is really, really very important because olive oil, and especially the high phenolic olive oil, is a food that can help our health during this difficult situation that we face all around the world. Moreover, the COVID pandemic has created several problems concerning the research projects. And as a result, many of our clinical trials were forced to stop since they included physical contact with patients. So we are not at the position to present the results that we had planned concerning the study of olive oil, and especially in two very important clinical trials on athletes and on diabetic patients. All our studies are now planned to start over after the summer. However, the last year, from September 2019 until March 2020, offered significant progress to several projects. And one very important project is the study with patients in early stages of Alzheimer's disease. And the results that we have presented last year are currently under publication. And we have to note that the initial study was performed using only psychometric cognitive tests that showed statistically significant improvement. However, now the study with the same patients has been enriched with biochemical results, showing again statistically significant improvement. Also, the study with the leukemia patients is also under publication, and hopefully it will become public in a few months. Again, in this situation, we have really very, very important findings that I believe that after their publication in the scientific journals, there will be a big change on how the society faces the high phenolic olive oil. However, The most important findings of our research during the last months are related with the metabolic fate of oleocanthal in the human body. And I'm happy today to present for the first time very important findings that we have achieved together with colleagues from Auburn University, with Professor Amal Kaddoumi, and also from Louisiana University with Professor Sayed. And this international team, altogether, we discovered what happens when we consume oleocanthal, when we consume olive oil high in oleocanthal, and what happens exactly to oleocanthal when it gets into our body. So we found that oleocanthal is transformed to a bioactive derivative that circulates in the body and can be found in the blood and the brain of experimental animals. And this is really, really very important because for the first time we know what happens to oleocanthal when it gets into the body. And the most important is that the same finding was confirmed for with the first human subject who accepted to obtain an intravenous administration of pure oleocanthal. Based on the studies that have been performed with this specific human subject, we know for the first time that oleocanthal is safe for direct intravenous administration for a dose up to 200 milligrams. And this is a very important result because it overrides any concerns about the safety of high phenolic olive oil. During the last years, some scientists have raised the questions how safe is to consume olive oil that contains high amounts of phenolic ingredients and especially high amounts of oleocanthal. Now we know that up to this specific dose, there is no concern and there is no problem. And this very important result opens the way to transform the phenolic ingredients of olive oil like oleocanthal to real drugs in the future. In addition, during the last months, we have completed the first statistical analysis of the results of 10,000 olive oil samples that have been analyzed in our lab since 2012. We know now the variability of the phenolic content in olive oil, and for the first time, we can set up the formal definition of what we call high phenolic olive oil. The European Union in 2012 set the limit at 250 milligrams per kilogram. Based on this regulation of the European Union, every olive oil containing more than 250 milligrams per kilogram can have a health claim. But what does it mean from a statistical point of view? Based on our very extended study of 10,000 olive oil samples, we know now that the statistical evaluation should set the limit of high phenolic olive oil at 500 milligrams per kilogram. And how can we say that? The statistic analysis showed that the average phenolic content among the 10,000 samples was 478 milligrams per kilogram. So for simplicity, it is better to use 500 milligram per kilogram as the limit of the high phenolic olive oil. Whatever is over 500 is definitely over the average of the high quality olive oils. In addition, an olive oil with phenolic content more than 500 milligrams per kilogram can maintain the health claim for 18 months. Our studies have shown that when an olive oil is bottled containing 500 milligrams per kilogram, then 18 months later, it will continue to qualify for the health claim of the 250 milligrams per kilogram. So yes, the limit of the high or definition for the definition of the high phenolic olive oil should be set at 500 milligrams per kilogram and not the 250. In addition, the term super high phenolic olive oil should be used only by olive oils with total phenolic content more than 1,250 milligrams per kilogram, which corresponds to the top 5% among the 10,000 samples that we have analyzed all the last years in our laboratory. And I think that it is this limit is a very good limit, that it's in agreement with the Aristotle Edwards. So I hope that during this very short intervention in this event this evening, I offered you some new important findings, and I hope that next year, under normal conditions, and we hope after the end of the pandemic, I will be able to present in more details all the fascinating results of the high phenolic olive oil on human health. Again, my warm congratulations to the winners of the Aristotle Awards for this year.